First number one for hip hop and R&B. This is the Beat of CT. I'm your host, Jenny Boom Boom. DJ Meechie, my co-host, is here as well. Hi,
Hey,
Meechie.
how you doing? How you doing today?
I'm doing great. And today we have Liany Arroyo, who's the Director of Health and Human Services for the City of Hartford, and Gina Federico, who's the Director for the North Hartford Triple Aim Collaborative United Way of Central and Northeastern Connecticut here. Hello, ladies. How are you?
Hello.
How's everything going?
Fantastic.
Fantastic. Okay. Are you guys both working from home right now?
I am.
Not I.
Not I.
Okay. Liany is out and about and she is working. So, Meechie, do you want to start with the first question today?
Yes. So, recently I know Hartford launched initiatives to address, the disparities in coronavirus outcomes. Could you guys talk about that?
Sure. I mean, I'm the health director for the city of Hartford. I am also Latina. And so making sure that our communities of color are at the forefront of a response, given all of the inequities that we face as it relates to healthcare, is critically important to me personally, and then also for my job. And so when we started hearing what was happening in other parts of the country, it was like, we can't allow that to happen here. We got to find ways to mitigate that and try to ensure that our citizens and our residents here in our city have the information they need. And so we had some really great partnerships and some really great partners. United Way, our two hospital systems, they immediately jumped in and we created some messages. We've got UConn and UConn students calling people, giving them information. And we're just out there just making sure that all of the information that's accessible to other individuals is accessible to our community as well.
That's great.
Gina, would you like to elaborate on that as well?
Sure. I, first just want to thank Liany and the city and Mayor Bronin for their leadership. And I think, one of the great things about working with the city is they are willing to reach out and say, hey, we want to shine a light on this. How can we help? And so, we saw that right at the beginning when this was happening, around bringing together the hospitals and the health department to work on key issues in Hartford to help our most vulnerable communities. And then really that expanded to, hey, we need to get the word out about some critical message about COVID-19. And so how can we do that? And so I think from the United Way's perspective, we were excited to do that because we work with community partners all the time. And so what a great way to reach the residents and reach neighborhoods and reach families using our relationships. So that was just fantastic.
And of course, with this whole reopening of CT that's happening, there's a lot more thinking about everything as far as I'm concerned at this point, right?
Yes.
So what should we understand about COVID-19?
So I think that the really critical pieces to understand is there's a lot that we don't understand or know about the disease and the virus. So I think it's important for our community to know that it's not that we as public health officials and doctors and our federal agencies that are in charge of this response don't know what we're doing. It's that there's a lot of information that's changing all the time. So I just first want to acknowledge that, because I know sometimes we're like, well, wait a second, you said don't wear a face mask. Now you're saying wear a face mask. Like, what's the deal here? I think first we just need to acknowledge that. Secondly, we need to acknowledge the fact that the disease spreads pretty quickly, right? And so that's what's really important. And it spreads quickly. It can spread through a household very fast. And so we need to make sure that we're taking the measures, like all that stuff our mama told us to do: wash your hands, don't touch your face, don't put your fingers in your mouth, all the stuff that I thought we all already knew, like we're kind of all getting a new lesson on it again, right? So we need to make sure that both we're taking preventative measures on our end. And then we also need to make sure that our government and the businesses that we're working with are putting proper procedures in place as well. So they're also a part of that. Other things to know about the disease is it has a much longer list of symptoms that we originally talked about. So we talk about fever, we talk about cough, we talk about trouble breathing, but recently the CDC, Centers for Disease Control and Prevention, put out a much longer list, right? And so there's a lot of other symptoms now that can mimic allergies, can mimic other sort of viruses that you might get. So it's important, if you have any of those lists of symptoms, headaches, chills, even like stomach problems sometimes are for some people, that's an indication that you get yourself tested. The city has 8 testing sites. So there's no reason if you want to get tested that you can't get tested. You don't need a prescription. You don't need insurance. You can just call, look at our website at the City of Hartford and find any of the locations. Another thing to know about the virus is that in terms of the spread, we also know that there are things that you can do to stop it, right? So we talked about the hand washing, we talked about the not touching your face. But the social distancing is really important, right? Because we want to create more space between individuals. And I know that might be hard for some of us because we want to hug our family members that we haven't seen in a long time, hug our friends and be out there. But part of the reason that you see cases going down or not going up as much as we were doubling our number of cases in the state every 2 or 3 days at the beginning of this is because we put all these measures in place. So as we're reopening, as you were talking about, Jenny, like as we're looking to reopen, we still got to do the same things if we want to make sure that we can keep ourselves and our community members safe.
Right. And I mean, how can people honestly feel comfortable with reopening? I don't know. I understand that we have to support businesses and we need to get the economy moving, but I have no idea how I'm going to feel comfortable sitting at a cafe, even outside, or, being around folks. And then I feel sometimes when I'm out, I don't even see folks with masks on.
Right.
So it's a balance, right? When we talk about health and we talk about public health, there's something that we refer to as social determinants, social influencers of health. And being employed and having good wages and having access to a job is also an influencer of health, right? So we're trying to balance both of these pieces, trying to balance that there's enough protocols and safety measures in place. And, quite honestly, I believe our governor has been doing a really fantastic job of listening to experts and listening to community members and employees and making sure as things come up that there is a way to address them. So, you heard about nail salons. They first they were going to open, then he said no, they're not, because it's just not safe, right? It's just not safe enough right now. Then hairdressers and barbers were set to open, and he made that decision because he heard from salon owners, barbershop owners, and employees. They just don't have what they need, and they don't feel safe yet. So I think we're lucky enough to be in a state. We were the last state to finally reopen, right? Because we had a governor that was really looking at what the science was saying. So I think if we make sure that we keep our government accountable, that they're doing what they said they're going to do, and then also we as community members take those preventative actions, that we can lower our risk to acquire the virus.
So Liany, also just touching on this really quick, the fact that I saw a video from Hartford that broke on Facebook a couple of days ago of hundreds of young people out at some house party in a yard. Did you see it?
I did not see it, but I heard a lot about it.
Right. So there's this video and there all these young people, and I'm seeing the police are pulled up down the street, but no one's doing anything where you're not supposed to have this many people all in one group. And these young people, I think they're invincible, but they can bring this back home and spread it to the older people in their households, or and not to mention that there's a whole nother strain of this now happening with children getting sick.
So you bring up a really, really valid point. And we here at the City of Hartford have been working hand in hand with Hartford Police. First we want to educate, we want to help break that party up. We want to provide people information. Our officers are carrying masks. So if they see groups of people congregating, they're going to go and they're going to talk to them, provide them education, provide them masks. And the experience that they've had thus far, it's been that people are open to hearing this information. It's hard, right? We've sort of been home for like 2 months now. The weather's getting beautiful. Like, I want to go to the beach. Everyone wants to do something. So we're working very hard here in the city to ensure that we're keeping people safe, that we're working to educate the community so that they can make better decisions. And at the same time, we also know that our police department has the power to issue citations, and they will do that if folks are not being mindful or respectful and going their separate ways when they enter a situation to disperse the crowd.
Because I mean, Meechie, when you saw the video, weren't you a little shocked?
Yeah, very shocked. 'Cause like you said, it was just nobody really had a mask on, and it was crazy. It was
And they
crazy
were
to watch.
all, rubbing up on each other.
Yeah.
Everybody was rubbing up on each other. And,
It's
I'm
true,
a
it's
mom, and I'm
true.
thinking right away, like, I want to go into, I told Meechie if I drove past that party, I probably would have rolled the windows down and be like, listen.
Yeah.
You got to balance, right? We're hearing stories of people being killed because someone's telling them to put on a mask, right? So
Right.
you want to be mindful, you want to be safe, and we want to use our powers of persuasion and our powers of education as that first step. And if we see places that continue to do that, we know our officers and our police chief will change tactics and move people around in order to address that.
Okay. All right. Perfect. As far as the emergency room, we're also hearing stories, and we've been talking about this on the air a little bit, about folks not wanting to go to the emergency room if they feel like they might have COVID-19. So can you tell me a little bit about when should we go to the emergency room?
So if at any point you have symptoms, particularly trouble breathing, you need to go to the emergency room. That's critical, right? Our hospitals, we get reports every day from our hospitals. They have sufficient beds to take care of everybody. They have sufficient ventilators to take care of people. They have, the personal protective equipment to protect you and protect themselves if you come in and you're sick. So if at any point you feel that you're having trouble breathing, we urge you to call 911. It doesn't matter if it's related to COVID or not. If you have chest pains, you call 911. There is sufficient capacity to take care of people that need to be taken care of, right? So that's the first thing I want to say. Second, we have this wonderful thing that many people have used in the past, but now has kind of become more mainstream, called telemedicine. Many of our providers, if you're too afraid to leave your house and you're not sure if you need to go to the emergency room or not, so many of our providers, as well as your personal providers and our federally qualified community health centers, are providing telehealth visits. So you can call, you can make an appointment. Sometimes it could be the same day, it could be the next day. At urgent cares, it's that at that point in time. You can call, they can set you up with a provider, that nurse practitioner, that physician's assistant, or that medical doctor can see you, using your phone. We use FaceTime to hang out with our friends and Messenger to see our friends. We can use that same technology to see a doctor. So if you have a question or concern and you're not sure what you need to do, call your medical provider or call one of our federally qualified community health centers. You do not need to have insurance to go to one of our federally qualified community health centers, and they can help you determine whether you need to go to an emergency room or not.
Yeah, and I'm also hearing, Gina, I'm hearing that a lot of heart patients are refusing to now go to the hospital.
Yeah, I mean, I think that people initially thought to delay going to the hospital to try to wait it out. And I think what they were finding is they were more acute cases. But I can even say from my own family, my stepson got a Lego stuck up his nose and we did a telehealth visit.
Oh my, you know what? My kids have done that in the past too. My daughter put beads up her nose one time. It's awful because you can't get it out.
Exactly. And so
it's all the way up.
And we FaceTimed the doctor and they said, you know what, bring him in. And honestly, we were in and out in 20 minutes and it was awesome. And so I'm just so glad it was, like Liany said, I mean, people are getting more used to FaceTime and, I would just absolutely advocate. They're making it really, really easy. Our frontline workers are just rolling with the punches. So definitely seek care for sure.
Okay, awesome.
That's great.
Meechie, you want to ask about quarantining? Yeah.
So, for the people like us that are, working at home, being at home and just trying to stay safe, what are some tips for, quarantining at home?
So if you're quarantining at home, we do recognize that some of us do not have the privilege of having a single family house with 4 bedrooms and 3 bathrooms and a basement and a backyard. So there are some simple things that you can do if you're in an apartment. Look, I grew up in an apartment. It was me, my stepdad, my grandmother, my brother, my uncle, and any other cast of characters of family members that might have come. And so what we would do is, and what you can do is, first of all, clean more regularly than you might have, right? Yeah. So you don't need the Clorox or Lysol wipes. some good old-fashioned soap and water works, because the virus is killed by soap and water. If you only have one bathroom and you have someone that's sick in your home, you can just get some gloves, the disposable ones, even like the ones that you wash dishes with, and then just wash them and hang them back up. Have that person clean the bathroom when they're done, right? With gloves on, wipe it down with some paper towels, with the bleach mixture. It's really basic things like that. Now, if someone's sick in your home and you got people sharing a room, because, hey, you know, I grew up sharing a room myself, there's things that you can do. Sometimes it's as simple as, if you have, you know, those screens that sometimes people put up as decorative, you can put that between a bed. You can hang a blanket from the ceiling down, right? To just create some space so that if you cough, that cough isn't going throughout the whole room. It's getting stopped by that blanket. So those are some really basic things that you can do. You know, if it's taking just a part of that room or something like that for that person that's sick, those are some basic things that you can do that kind of, you know, really fit into the circumstances that many people in our community find themselves in.
Okay, so Gina, what about people's mental health while home?
Well, that's a great question. I'll let Liany talk a little bit more about that, but I do know that our community health centers are offering both physical health and also mental health needs. And I know, Liany, your office has been kind of largely leading that. What else is going on there?
So all of our providers, I speak with our federally qualified community health centers that treat adults. There are 4 of them in the city every week. And all of them are even doing behavioral health appointments via telehealth. So if you can do it via phone, or you can do it via any sort of like Zoom, FaceTime. Many of them have their own sort of private portal. You download an app, and through that app, you can meet with them. It's more secure. So there's many opportunities to do that, again, via telephone or via some, you know, with the using some video conferencing. So if you're feeling like you need assistance, please call your provider. If you don't have one, you know, 211, which is through the United Way, is an amazing resource. You can call them. They can provide you hotline information. They can provide you places where you can call and get immediate help. No one should feel alone. We have resources that the state has put in place and that our providers have put in place to help you get through this time.
Okay, awesome. So, I mean, I also thought when I saw one of the press conferences with the governor, and just clear this up for me, ladies, aren't there like certain places that people can stay if they do have a very crowded home that they can go and kind of go stay at if they're having like mild symptoms?
So there was some places put in place for first responders. So that was something that was geared towards them. Okay. So any first responders in many of our cities had access to dorm rooms across the state. And so that was one thing. Even in the city of Hartford, we had dorm rooms at the University of Hartford set aside for us as essential workers if we felt that we wanted to stay there to avoid bringing the virus home. So that was something. We have been working with our homeless community, individuals that are experiencing homelessness here in our city in particular. And so if someone is homeless and they test positive and they're at the hospital gives us a call, and we have a location that we can provide them so that they can quarantine themselves there, isolate themselves there before they go back to their shelter bed.
Okay, awesome. Nice. Wow. All right.
And, what can you guys tell us about contact tracing?
Sure. So contact tracing, a lot is happening with contact tracing. So if you don't know what contact tracing is, I'll just
because I don't know what contact tracing is. Meechie must know what that is. Me and Gina, we don't know, Liany, okay?
So I'm going to briefly explain it. Contact tracing is a process by which when we at the health department are notified that we have a case among a city resident, right? So there is a system in place that the state has. We get notification. We check that system multiple times a day. And we will see anyone that tests positive, no matter where you were tested. Like if you get tested in Massachusetts and you test positive, that information makes its way to Connecticut and then makes its way to me. And so my team will go and see this person is positive. We will then call you and we will ask you, what were you doing the 2 days before you experienced symptoms, or the 2 days before you were tested if you were asymptomatic, right? Right. And so at that point in time, if you were at a large gathering, let's say, you were at that house party this weekend, or you were working because you're an essential worker, we will then work with you to identify who we may need to reach out to. Our focus right now here in the city has been reaching out to employers because we do have so many individuals that are essential employees. So we're reaching out to those employers and saying, hey, you had an employee that tested positive. They were at work these days. We need you to, everyone that they were in contact with, we need that information. We can contact them, or we can work with you and you can reach out to them and tell them what they need to do. And so we engage in that process with them. The state has unveiled a new system which will help us do our work more quickly and allow people to do monitoring electronically. So we will call you, we will ask you, do you want to get electronic monitoring, which basically means you give us the information, we enter it, and then we will send a text or an email to all of your contacts saying you were in contact with someone that tested COVID positive. We recommend you get tested or that you isolate at home for the next 10 days. We don't tell them who it was. That's not any of their business. We're working with you. It's anonymous when we reach out. So it's basically a system where we reach out to you if you test positive. You tell us who you were in contact with, where you were. We then reach out to those individuals, and then we tell them what they need to do in order to maintain their safety and keep their family safe.
Okay.
Wow, that's incredible.
Wow. That is incredible. You know, but when you're talking to me about all this, I just keep thinking like this has been such a serious and strange situation that we've all been going through. And here we are, everything's now reopening, but I hear the governor today say businesses need to be prepared just in case there's a second wave of this that comes through in October, like they think it's going to happen. So it's almost like you said, it's like you're learning something new every single day, and every single thing that happens almost takes your breath away.
Yeah.
It does. And, we do need to be prepared. Like I said, there's so much we don't know about this virus, right? Originally folks thought it was just like the flu. It's not so bad, but some people can get really, really sick. We're realizing it's not really that much like the flu, like we thought initially. And so we've had to change how we talk about it. And so very well, now that we're reopening, more people are in contact. Look, we're all human. It's human nature. We start letting our guard down. We might not wear our mask all the time. We, might not practice social distancing. We might decide, hey, I want to have my neighbors over for that, get together in the backyard. And so that's what we're talking about. Like, we can't let our guard down. If we all do our part and our businesses do their part, then if there is a second wave, we can make sure that it's not as bad as the first wave, that not as many people get sick, and that our hospitals are ready to take that influx of individuals in. But we still have to keep our guard up. And as our mayor has continually said, today is May 20th. It doesn't mean that we flip the switch and everything goes back to normal. It's a new normal until we get a vaccine for this disease.
I just don't know. Like I said, when I'm out and about, I don't feel like people are scared. Like I was in front of a shopping center the other day, and the store, I see 100 people walking in there, and some folks have masks on and some don't. I just don't know if the messaging is really getting across like it needs to.
Well, I think if you all have suggestions, your audience as well, right? I think we need to be more nimble in public health and in government and make messages in ways that resonate with people. There's an old saying that people like to say, we're flying the plane while we're building it. That's what we're doing. In a perfect world, I would have gone out and said, hey, I need to meet with a group of young people, ages 15 to 18, to talk to them about this. What would help them do this? I need to meet with a group of other people. We didn't have time to do that. It is my hope that we can do that now when things start, getting a little more calmer. We don't have as many cases, to allow us to get ready for that second wave if it comes, and have the right messages for our community.
I can get real preachy, Liany. I ain't got no problem with getting preachy. There's no problem. So what other resources are available to the community at this point, Gina?
Sure. So I think, there's all the medical pieces and the clinical pieces that Liany talked about, but then people are also hurting right now. We have a lot of folks out of work. We have a lot of folks, who are home with their families, they're helping out. And so just to reinforce, 211 is the state's information and referral line. So if you have a question about health issues, if you have a question about unemployment, if you have a question about housing, food, it is open and available to everybody to be able to call in and find resources. A new one I even learned about today is if you need kind of emotional supports for your kids that are home, you can call and they give you some resources to work with them. I think a lot of people are feeling a little bit isolated. School's not going to go back in session. And so I think even things like that, supports that we can use ourselves that aren't even at another agency, that they really do have the latest information available. They also, I will say, are doing mask donation. And so please call if the issue is that your family can't get masks or needs more masks, or an organization or your church, please call 211, because that's something that's also being coordinated through that hotline. And then at the end,
we might be, Gina, wearing masks till January, February.
I feel like everybody needs like some disposable masks, some like hand sewn.
We need some designer masks.
I saw someone have Louis Vuitton masks.
Someone had a Louis Vuitton mask. How much did that thing cost?
Selling in the North End. Somebody was selling.
That's like $1,000 right there.
I don't know if they were real, but they said Louis Vuitton. So I think there's going to be all kinds of mask situations. So, I think the other thing we're really working on is people are generous right now. And so the United Way is working with the generosity of others to work with community-based organizations to provide funding. That's our Neighbors in Need program. We're giving money to, homeless shelters. We're giving money to Food Share. Folks saw the work happening there. Local church groups that are helping their neighborhoods. So that's happening. And then statewide, which is really kind of interesting, the United Ways have all kind of come together, and funding they've gotten from mostly corporations, they are providing individuals with actual gift cards. So I think Liany's office has administered some of this, but I know at least in Hartford, over $25,000 has been available for cash assistance to people to spend on whatever they need.
Oh, well, that's awesome.
Yeah, and I will say that we've actually we're able to look broadly at what people are spending it on, and it's food, it's rent, it's utilities. So that makes you feel really good that people are able to, continue to run their households and keep going, because it's a hard time.
Yeah. Right. And will it get better? I mean, I'm just asking your thoughts on this because, a lot of folks, they are reopening, but they're only at maybe 50% of, their staff.
I think over time, it's going to be a slow process, right? And I think over time, things will get better. We keep talking about the new normal. I don't, in many ways, don't want to go back to the old normal. That old normal wasn't good for my community. It wasn't good for a lot of people that lived in Hartford. It wasn't good for poor people across the state. And so I hope that as we move and continue to reopen, and that we look at what's happening around the state, that we look at a better normal for our community. Right. And so I think that, it might not look the same, but I think that we have the opportunity to make things better for those in our community that were the most vulnerable and had the least.
Okay.
That's a good way to look at it.
Well, ladies, we'll see what happens. That's where we're at, right? Every day. It's like, fingers crossed, things get a little bit better, I love all of this information. And we're just still 2 months later absorbing everything. I don't know how you feel about it, Meech, if you feel the same way, but yeah, it's been a very strange journey.
Yeah. Definitely very strange. I've been working more than 8 weeks straight, and I'm looking forward to some downtime. But honestly, we have an opportunity to build a better Hartford, build a better Connecticut. And, it's sad that it took a pandemic of this proportion to have these conversations, but I look forward to our leadership and those people that have been working really hard to make a better Connecticut. They have a bigger voice at the table now. And so I'm looking forward to building a better Connecticut that works for everyone.
Well, I think that we should regroup, the four of us. Let's say, let's do, July. And let's just kind of do a check-in to see how things have progressed. Yeah.